She never told a soul what had happened. She never went back to camp, and she never had a normal bowel movement again. I'm Dr. Robin Chakhan, gastroenterologist, microbiome expert, and author, and I am here to help you find gut bliss. On today's show, something that a lot of people suffer from without realizing it. It's a really common GI problem, but most people don't have any idea why it's happening. To understand the origins, let me tell you about a patient of mine, Sherry. Sherry struggled with constipation her entire adult life and most of her teenage years. When she first came to see me, she had already tried lots of different supplements and a couple prescription medications to try and get things moving. Nothing helped. I put her on a tablespoon of fiber in the morning, 400 milligrams of magnesium in the evening, and something called an osmotic cathartic at night that draws water into the stool to make it softer and easier to pass. I told Sherry she needed to drink at least half her body weight in water every day. She weighed 150 pounds, so that was about 75 ounces. I also made sure she was moving around enough to stimulate peristalsis, those wave-like contractions in your gut that propel things through. And I want to emphasize these two things, hydration and movement. A lot of gastroenterology is actually just plumbing, and the best way to clear a clogged pipe is to run a lot of water through it. That works in the GI tract too. So if you're constipated, make sure you're flushing out those digestive pipes with lots and lots of water. In terms of the second point about movement and gut peristalsis, let me sum it up this way. If you're not moving, neither are your bowels. Sherry was doing all of it, hydrating, exercising, plus eating tons of fiber, and still no action. As I got to know Sherry better, it became clear that hers was no ordinary case of constipation. There was something more complex at the heart of her inability to move her bowels. And then one day, after about a year of taking care of her, Sherry told me a story from her childhood that explained everything. Here's what happened. She was in 8th grade and looking forward to going to the same sleepaway camp in the Catskills that both her older brothers had attended. Summer finally came, and Sherry was one of the first campers to arrive. As part of the initial get-to-know-each-other festivities, a second day at camp involved a long hike with Sherry's all-girls cabin and the cabin next door, which was all boys. They left early, and Sherry kind of felt like she had to have a bowel movement that morning. She had a little urge, that knock-knock, I think someone's at the door, but she just didn't have enough time. So off she went with her fellow campers. A couple hours into the hike, she really started to feel like she had to go. That knocking got louder and more urgent. So when they stopped for a break, she thought, okay, now's my chance. She put some tissue in her pocket and went off and found an isolated spot in the woods surrounded by trees for privacy. And she proceeded to squat down and do her business. And yes, you know what happened next. A group of fellow campers, all boys, saw her leave and they followed her. They came across Sherry with her underwear and pants down in the middle of having a bowel movement. The stool was literally exiting her bottom when they arrived, half in, half out. Now, I want you to imagine what that felt like for a 13-year-old girl. Indescribable. Horrendous for most adults, much less a teenage girl. Sherry was so humiliated by the experience that as soon as they got back to camp, she called her parents, told them she was sick, and had them come pick her up and take her home. She never told a soul what had happened. She never went back to camp, and she never had a normal bowel movement again. The feeling of shame associated with moving her bowels was so ingrained in Sherry that day that from then on she could only have a bowel movement in absolute privacy with no one around, including her own husband and children. She would wait until late at night when everyone was asleep to use a bathroom, and she wouldn't even flush a toilet until the morning because she was so afraid of being discovered. Moving her bowels at work, in a restaurant, or when her family was awake and around was completely out of the question. The Gut Bliss podcast is brought to you by VisBiome, my first and quite frankly, my only choice for a probiotic. Whether you're dealing with irritable bowel syndrome or just looking to restore your gut health, VisBiome can help. It's a medical food for the dietary management of IBS and gut inflammation. Backed by science and clinically vetted by thousands of my own patients. Find your gut bliss with VisBiome. Go to visbiome.com/gutbliss and use discount code GUTBLISS at checkout. Sherry had an extreme case of a medical condition called shy bowel. The technical term is parcopresis, and it's also known as psychogenic fecal retention. It involves difficulty or sometimes a complete inability to have a bowel movement in a public toilet due to this overwhelming fear of perceived scrutiny, a fear that people are going to hear what's going on, they're going to smell what's going on, they may even see what's going on. In severe cases of shy bowel, the difficulty or inability can occur even in your own home, like with Sherry. Shy bowel is different from the normal embarrassment many people have about bowel movements. I mean, no one wants to have a bowel movement in public. But with shy bowel, the extreme need for privacy can impose some serious lifestyle limitations. Shy bowel is classified as a psychological condition, but there are important physiological factors that can cause it. And one of those is holding. It's one of the first questions I ask constipated patients, whether they were holders when they were younger, meaning when they felt an urge to go, did they frequently ignore it? Kids spend a lot of time at school where the bathrooms may not be that clean or that private. And a lot of my patients tell me they never use a bathroom at school when they were kids. And as a result, they now struggle as adults with constipation. But what's the link between shy bowel and constipation? Let's do a quick review of what happens when you have a bowel movement. And I promise you, this is going to be much less gross than you think. Your rectum is a reservoir that stores a stool before it exits. It's about 6 inches long with a diameter of 1 to 2 inches, and it's super distensible. It's like a balloon. You can inflate it to dramatically increase the storage capacity. How good is your rectum at holding stool? It's really good. The volume at which most people can feel like they have a bowel movement in their rectum is about 1.5 tablespoons. But the maximum volume that you can hold in your rectum is about 28 to 30 tablespoons. And that is a lot of stool. So that sounds pretty good. Your rectum is not that big, but it can expand to 20 times its normal size. So you can wait around all day to have a bowel movement. And that should not be a problem, right? No, wrong. That's a big problem. Let me explain. 2 sphincters, which are essentially muscles, wrap around your rectum like a sheath. And they're responsible for the important jobs of keeping your stool in and getting it out. Your internal sphincter is under involuntary control, kind of like your blood pressure or heart rate. And that sphincter is normally in a contracted state to keep things closed tight to prevent leakage. When the internal sphincter relaxes, that lets the stool out. Your external sphincter is under voluntary control. You can relax or contract it whenever you want, depending on whether you're trying to push stool out or hold it in. Having a bowel movement involves both voluntary and involuntary actions. Your internal sphincter relaxes to release the stool, and then your external sphincter contracts to push the stool out. When it's all working well, it's a beautiful thing. You feel that urge, you go sit on the pot, the stool glides effortlessly from your rectum into the bowl. But here's the thing. For it to work, you must heed that call when it first happens. Ignoring the urge and holding your stool in when it's trying to come out can cause all sorts of problems, including something called reverse peristalsis, where instead of exiting, your stool goes back up into your colon in the wrong direction. I like to call it prairie dogging because it's like the prairie dog, which I've only ever seen at the zoo, but it sticks its head out of the hole and then back in the hole and out of the hole and back in the hole, but it doesn't actually come out, or at least I've never seen it come out. So the longer you hold your stool in, the more water gets reabsorbed from it and the harder and drier it gets, making it even harder to push it out. And you've probably experienced that. After holding your stool all day, what finally comes out is this dry, hard, fossilized poop. When you do this over and over, you confuse your sphincters and you end up retraining your muscles to do the exact opposite of what they're supposed to be doing, so that when you actually want to have a bowel movement, you may not be able to. Diagnosing my patient Sherry with shy bowel was just the beginning of the journey. It took several months of behavioral therapy and physical therapy to not just retrain her muscles, but to retrain her mind so that she could feel relaxed enough in the bathroom to have a bowel movement. Although we often see the foundation for parcopresis laid down in childhood, shy bowel can develop in adults too. When we first got married, my husband was very reluctant to have a bowel movement if I was hovering nearby. And he was totally scandalized by the fact that I could have a bowel movement with the bathroom door cracked open while having a conversation with him. He's still a lot more private about bowel movements and passing gas than I am, not surprising, but I've gotten him to relax a little about some of that stuff, and his bowel habits have gotten more relaxed too. He still pretty much needs a door closed, but it's okay if I'm in the general vicinity. When it comes to your bowel habits and staying regular, I want you to remember 3 things. Number 1, everyone poos. Bowel movements, even ones that are smelly or noisy, are nothing to be embarrassed about. Everybody's doing it. Number 2, if you struggle with constipation and you've tried everything, consider looking into physical therapy, biofeedback, or other relaxation techniques to see if that might help. And finally, you must heed that call and drop it while it's hot. So that's it for this edition of the Gut Bliss podcast on shy bowel. Go to gutbliss.com for my free 7-day microbiome reboot course. If you like what you're hearing, drop a review and hit that subscribe button. And remember, dirt, sweat, vegetables, the best prescription for a healthy gut. Coming up next week on the Gut Bliss podcast, the real explanation for why colonoscopy is a lot more challenging in women, and I can tell you, as somebody who's done thousands of colonoscopies, that is definitely the case, but it has nothing to do with differences in pain threshold and everything to do with anatomical differences between the female and male colon.
The information presented in this show is not meant to be medical advice. Consult your doctor before making any decisions about your health. The patients discussed are real people, but names and identifying features have been changed to protect their privacy.